I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it.
So the Stepping On program is a free community-based program that's a falls prevention program.
This is a side leg lift, and this is going to strengthen the sides near your hips here, and this is really good for balance.
So I'm the Stepping On coordinator for Nepean Blue Mountains Local Health District. So I help coordinate the programs in Penrith, Blue Mountains, Lithgow and Hawkesbury local government areas.
Can everybody feel that on both legs? Because you're actually balancing on one leg.
And it's for people aged 65 years and over. And it's also for Aboriginal and Torres Strait Islander people 45 years and over. And it aims to keep people independent and living at home through increasing their confidence and skills and ultimately prevent falls.
Well, we were told about it here, and I come to the luncheon on a Tuesday, and we were told about it. And we decided that the three of us needed to come to stop us having falls, hopefully.
Yes. So what we're going to do first is how to get up from a chair. Okay? So what I'll get everybody to do is sticking your feet forward, right under your knees. So not sticking forward in front, but right under your knees. 2, 3, up. Okay, so I'm going to give you people a hand. Do you find that bit a little bit easier?
We've done a few exercises, which we've been very good in doing at home. Hopefully they're going to strengthen our balance. And if you do have a fall, today they show us how to get up.
Thanks for having me. My name's Adam, I'm a physio. I work in community health, and so we work across the Blue Mountains and the Nepean and Hawkesbury area.
So all Stepping On facilitators are trained health professionals from a variety of backgrounds, including personal trainers and physiotherapists, and they undergo specific training in Stepping On before they can conduct a program.
I work as a physio, and we did some training in the Stepping On program a couple of years ago. So now we consult on week 2, which is the Stepping On and Moving Safely week, about 4 times a year.
For people who are involved with like an individual therapist, this isn't to replace, like the exercises here aren't to replace what's been set up by an individual therapist. So if you have any queries around that, it's best to sort of just check it just in case there's a specific example. So yeah, exactly. So we'll take you through these, but if you have any questions, feel free to ask.
So the program runs for 7 weeks, 2 hours per week, and there's a booster session 2 months later. Each week different topics are covered, including medication management, footwear, vision, nutrition, and also home hazards, and they're delivered by guest speakers. Also the participants do gentle balance and strength exercises each week.
Today we have a physio from Nepean Hospital, her name's Yin, and she's going to cover some topics. She'll go through them with you. We'll have a bit of a break, we'll go through the exercises, and then we'll also talk about how to get up safely from a fall.
I guess there are 2 challenges with climbing up and down the steps. One is your strength. Using one leg, taking all your weight to push your body weight up and down. Which is why to actually keep practicing standing up, sitting down as an exercise is very important, because that really maintains your the strength in your thigh, which is what you need to control your knee as you go up and down the step. The other challenge is balance, because you're lifting one foot up and standing on one foot momentarily as you place the other foot on top of the bottom of the step. Which is why we're doing balance exercises in this group.
What she has shown us is very good. We have seen it done before.
So, and Colin, what you want to do is take a seat first. I'll get you to move to the edge of the chair. Make sure that you're only sitting a third of the chair. Okay, and feet nice and wide, even a little bit wider. Yep, and when you swing your shoulders forward, don't stop. So you're aiming for an L.
I'll aim on
J
it. That's
shape.
a bloody no, there we go.
Yeah, that's a common misconception that when we go forward, we're going to fall forward. Okay, but if your weight stays behind,
More or less we're probably going back, isn't it?
you're not going to be able to get up. Okay, how about I'll stand right in front of you. Just go as far as you can. Try not to stop halfway. Push through the legs. Bottom in, bottom forward, and knees back. Okay, good. All right. Do you want to sit down and practice that one more time?
No, for sure.
No, it is a low chair. 1, 2, 3, forward. Oh, there we go. Okay, take a seat. Now, sometimes use a bit of momentum will help as well.
What we're going to do is just demonstrate how when you distract someone it actually affects their balance. Okay, start counting backwards from 100 by 3.
100, 97, 94, 91.
We just made you do maths just because it was fun, but like the mental challenge of being in a shopping centre, right, with this sound and that happening and the kid running in front of you and there's something slipped there and
Stop suddenly. Yeah.
you know, having to start and stop suddenly, all these things, right, you might even be able to do this in a controlled environment at home, but you add all that sort of stuff to it, then suddenly you're like, wow, your risk increases. So we don't want people to feel like they're just contained to their home, because that's generally not good for you, right? Okay, knowing that that's the case, where will I park so that this is where I'm going to walk, you know? If I walk there, there's going to be a rail. You know, these sort of things you can start thinking about, right? Yeah. Now, we've all heard the horror stories of, you know, the poor souls that have fallen over. There's been no one with them, right? They've died in their house because they've been lying on the ground, but no one knew for about a month, right? We don't want that to happen, right? So we need to make sure that, you know, in amongst your social circles, right, you've got some people sort of regularly checking on you. That it doesn't involve you checking, you know, you can return the favour, of course, but they're the low cost things that they can save your life. There's a few ways of getting up after fall, right? The main thing is to first, make sure you've got a clear mind, right? Make sure that you feel safe to do so, that you've got no pain, no things sticking out at weird angles, right? Yeah. If you feel safe and you just know in yourself, right, then you know that you can do it, that's the thing. You know that you can do it, then that's the time to try. One method is to sort of, it'd be a bit hard here, I might just need to describe it to you. One method is to sort of bottom shuffle, right? If you can get yourself into a position like this, you know, you can kind of bottom shuffle up to...
I have to do that.
Yeah, and you can bottom shuffle up to a step and you kind of put yourself up to the first step so you're high enough to kind of sit up.
You're crawling the ends and knees sometimes.
That's right. So that's the other method is sort of like, I'll do it here. Sorry, it's not that glamorous. But say I've fallen here, right? Usually the best thing is to get your legs up, roll onto your side, right? And then flip over onto all fours, hold onto a chair, one leg, and then two legs.
I've tried that and I
Make sure the
can't
chair's
do it.
stable. Yeah. Now, if you can't do it, then it's probably good to see a physio to train yourself to do it, right?
Well, I've learned how to get more confidence in myself. I'm starting to get more confidence, but I haven't got that much yet. But doing the classes and that, it does help. And doing the exercises, because it gives you the balance and everything, but I don't like going to shopping centres.
You always have participants that are very quiet in the beginning and they're a little bit uncertain about what they're getting into. They're very hesitant to undergo any exercise, and by the end they are very social. They really sort of have been thinking forward and what they want to do after the program. I think it gives them a lot more confidence.
Well, I only get to do week 2 at the very beginning, so I don't actually get to see all the progress, but I do hear back from the facilitators how well people have gone, and the social networks that they form. Often they start exercising together in groups. We know from the research that there's a 31% reduction in falls anyway, so if the program is run as it's meant to be run, then we're almost guaranteed a result. But I do hear lots of good feedback.
I like to move it, you like to move it. I like to move it, I like to move it. I like to move it, move it. You like to move it.